So I'm a GP. As I said I spoke to a few of you at a dinner the other night, and as I said, when I entered general practice, there were no practice nurses, and none of us could really imagine why you'd have a practice nurse. Now you would not even contemplate working in a practice without at least one practice nurse, if not more. And what I've been involved with over the last 15 months in my time on a project which has been half funded by Medibank Private and half funded by the Department of Health is, I think, this beautiful little window into what I could see general practice could be doing in another 10 years' time. And it's actually expanding that incredibly effective team of GP and practice nurse to include a few other people who can really get out there and spend time on the ground outside of the practice and be feeding information back into the practice about our patients and be assisting our patients a little bit more outside of the practice in their ability to manage and understand their own healthcare. And I'm sure over the last couple of days and today you've probably heard so many people talk about this tsunami of people that are going to be coming to us for care in the next several decades with people living longer and with the number of chronic health conditions that we are living with. And we know that our health service at the moment, where we're all working in little silos, is never ever going to be able to cope with what's going to be required of us in the future. And so the project I've been working on is starting to put a toe in the water of how can we actually do this better? How can we change what we do to work in a different way that is going to be good for our patients and it's also going to be good for us? So I will first of all just talk to you a little bit about Medibank and where Medibank is going, because I think when you hear Medibank Private, you think a health insurance company, and I used to think before I worked in the company that is when you have a service and then you take your bill to the little shop down the road and you get a refund for whatever service you had, or for a couple of the services you've had. So CareComplete is what I'm going to come to talk about, but first of all I'll tell you a little bit about the changes in health insurance. So Medibank has really divided into almost two arms. So it's got its insurance arm, and that insurance used to be very passive. The patient would come along, do the claim would be paid, and away they go, and really there was no other interaction. Whereas Medibank has now set up a separate arm, if you like, which is actually looking about how do we empower our members to look after their health more effectively. So that has that started with one of the senior people at Medibank who was a psychiatrist, and he saw the huge need for his patients when he was working in public, and he went out and set up some extra services so that these patients could access services that they couldn't previously access. That was formed into a company called Australian Health Services, and then Medibank ended up buying that. That man is still with Medibank, and he's still got this vision for how he sees we can actually be supporting and encouraging patients to do more. So Medibank no longer just is an insurer, it wants to be a very active entity who's out encouraging members and empowering members to look after their own health. And we also, because we're a huge company with a lot of infrastructure, we've actually developed some expertise in certain areas. So we actually run, and I'm just having a complete blank for a minute, we run nurse on-call services, we run some of the after-hours doctor on-call services, we have run telehealth services in the past, which we've now sold off. We run Garrison Health, which provides the health care to 50,000 of the Defence Force. That's the total of the Defence Force. And what we do is we don't actually necessarily provide the one-to-one services. We provide the infrastructure which allows that to work. So it's getting the providers in, getting the providers paid, seeing that the service works effectively, quickly, reactively. That's the sort of expertise you need to see a health service work really well. We also have the National Insurance Disability Scheme. So that's all starting to roll out, and people are going to need to be assessed to get onto the National Disability Insurance Scheme. And so again, Medibank have contracted to do that. We now do Beyond Blue. So we very much see that we've got this fantastic opportunity to develop services and put them out there for others to use. So even though what I'm going to talk about today is very much in the next little while about what Medibank can do for Medibank members, we see this as really being able to become something which can go right across the board for public and private patients. And hopefully we can be providing some of those services to both. So that's just to tell you that I'm not just up here talking about reducing costs for an insurance company. I'm really up here talking about how do we empower patients to look after their health better. There we go. So this also comes from the fact that we know that both in Medibank and in the public health system as well, there's a very small number of patients who take up a very large amount of the health dollars. And so people have looked, Medibank have looked, but people across the world have looked at who are the people in that 2.2% and what are they like? What are their conditions? What's going on there? And what we know is they are chronic conditions. So most of that, 1/3 of all hospital expenditure is being paid on helping people manage their chronic conditions. And so that leads you to go back and say, how can we manage these chronic conditions better? And we need to look at that in a primary prevention sense, a secondary prevention sense, and a tertiary prevention sense. So the project that I've been working on, which has been half funded by the Department of Health, half funded by Medibank, is looking at coordinated care. And coordinated care is a system of providing care to patients which has been shown in many other countries to reduce avoidable hospital admissions to between 20 and 30%. For our project, we're hoping to achieve between 15 to 25%, but we know that in actual fact it's been done elsewhere very successfully in systems that are not dissimilar to our own, and we're hoping to achieve the same. So these are the sort of percentage reductions you can achieve in hospital admissions from heart failure, 25% reduction, amputations, 34% reduction, stroke, 45% reduction, by actually getting in early, helping people to prevent health issues and manage these issues more effectively in the community. Because hospital services are very expensive. People often don't like them very much. We all know our patients do not like being in hospital very much. And we're encouraging people to try and manage these things more effectively in the community. Now, the only way that can happen effectively is for those services to be embedded in general practice. So they must be embedded in general practice. The GP and the practice nurses must be controlling the patient's care, and what we are trying to do is supplement what they are doing. We're never trying to take away from it, we're not trying to remove it, we're not trying to do their job, we're only trying to supplement what they're already doing. So the care programs which Medibank are launching will facilitate a smoother health journey for patients, improve patients' outcomes and quality of life, and that's been my great joy in watching this project develop, is to see the changes that you can actually achieve in people's quality of life on the ground, to support primary healthcare teams, and to take the pressure off the healthcare system. Those are our aims. You've probably seen pyramids like this before. This is called the Wagner model, or the Kaiser Permanente pyramid, and it's based on looking at trying to stratify people's risk according to their health problems. So at the bottom, you've got health promotion and healthy populations. So Medibank's approach to that is to say, okay, we need to be promoting people to get out there every day and just improve their health. So we will pay for things like supplementing people's gym programs, a lot of advertising and getting involved with programs like runs, triathlons, all sorts of ways of just saying to people, it's really good to get out there and exercise and just be thinking and looking after your health. Then you move up to the chronic disease. And these are the patients where we want to pick up when they're first developing their chronic diseases. We want to give them, empower them to be able to look after and manage their health better. And then, and they're going to be the ones in the long term who go up into that pointy end of the pyramid where we actually have integrated care. And these are the people with chronic complex health issues who really need extra support in being able to manage their health care. They're vulnerable, they're often socially isolated, they're often impaired by their illness and being able to make good decisions for themselves, and they really do need extra care. Okay. Is that fine? So The CareComplete program consists of 3 components: CareFirst, CarePoint and Care Transition. And I'll just tell you a little bit about each of those. So CareFirst is really a secondary program. It's about identifying risk early and then providing the patient with some health education and health coaching to help them develop patient-centric goals and to support them in their behaviour change. So how that happens is that we will provide, so we're looking for people over the age of 40. They usually have 1 or 2 chronic conditions, and we will provide them with health coaching, which will happen in the general practice. And that can either happen by us providing a health coach to come into the general practice and give the patient up to 6 sessions, or even better is that Medibank will provide the money for you as practice nurses to be trained in health coaching. And that program is by the Australian Health Coaching Service, which is an approved and proven provider of health coaching, so that you then are the one in the practice providing that health coaching to the patient with the early chronic condition. So Medibank would pay for your training, and then they would pay for each patient that's enrolled in the program, and they would pay you for each patient that you are actually doing health coaching with. And why is that? Because we know that in general practice you're already doing so much in such tight financial constraints that it's got to be funded. These things are fantastic ideals, but they have to be funded, and so that's what's going to happen. I might skip over I'll come back to case studies for if I have the time. CarePoint is what I've been working on. This has been our pilot program for about the last 2 years. It will finish about halfway through next year. It will be externally evaluated, and it takes that group of patients who are at the really nutty end of really being very, very ill with chronic problems, bouncing in and out of hospital, and we see if we can actually improve their care. So we go into the general practice, we talk to the general practitioner, the nurse, we look at their health profile in the health summary. We go out and do a home visit, and we look at what are the real issues on the ground for this patient. What's in place? Leave that alone. Whatever's working well, great, keep that going. But where are the gaps, and why is this patient not being able to access good health services, or why are they not understanding what their health issues are, what's going on, and what can we do to plug the gaps? So we have the care coordinator, who's an extra pair of hands, and that's who I see as being a really important part of the health team in the future, who's going out and bringing back the information. We know when you do your 75 and overs health assessments at home, you get enormous amounts of information by going into someone's home. You work out what they're not taking as far as their medications go. You see the hoarders who are actually got, the biggest falls risks you've ever seen. You see the holes in the carpet where it's a huge falls risk. You find out that the 90-year-old has just come down off the ladder because he's just finished doing his, cleaning out his gutter, even though he had a stroke a year ago. So there's so many things that you can pick up when you go out into someone's home. It's so rich. Health coaching. So not only have we got the care coordinator can do the health coaching, but we've also got in the CarePoint program a care navigator who is someone who touches base with the patient on a monthly basis just with a phone call. So they're in touch with the care coordinator. Care coordinator says, can you ring Jim next week? He's got an appointment at the hospital. He might not be able to get there. See if he can get there. We can organise transport if he can't. Haven't touched base, haven't heard from him in a while to see if there's anything going on. And patients love it. There's a group of patients that really love just having someone call in once a month and say, how are you going? And if I have time, which I probably won't, we pick up some really important things in those telephone calls and can say, you really must go back to your GP and talk about that. And patients will say, I've got an appointment in 2 weeks. Okay, I'll talk about it then. And you have the opportunity to say, no, this is really important. You cannot wait 2 weeks. Or they say, I rang the practice, but there's no appointments. But the patient hasn't said, but I've been having chest pain for the last 2 days. So it's really about trying to teach the patient how to navigate that health system and get them back to the GP so that the GP can be doing their work and so that you as the practice nurse can be doing your work. We encourage them to use nurse on call. We encourage them to use after hours on call, and we really try and make a big difference, and we can, and I wish I had more time to tell you about how we can because it's really exciting. And then the last bit of the CareComplete program is Care Transition. Now this is still in pilot phase. Care Transition is about health coaching for people when they are discharged from hospital. Ideally before they even go to hospital, while they're in hospital or when they come home, to say what's going on, What's happened in hospital? Do you understand that? Have you had changes of medication? Does your GP know? Has your GP got a letter? Can ring, have you rung your GP to say that you're home from hospital and you need an appointment? So it's a system which has been used across 9,000 major tertiary facilities in the United States, been used incredibly effectively. It's never been done here in this format before. It's something that you just overlay on the services that are already existing. So the thing about all of these is that they're supplementing, they're adding to what's going on. We're not trying to reinvent the wheel. If something's already there and it's working and it's in place, great, we can use our resources elsewhere. And I think Brian would really love me to stop talking around about this point. So thank you so much for all of your attention. The CareComplete programs are out on our stand, and it works through general practice. We'll be coming to talk to you. We would love your general practices to be involved. And we understand every general practice works differently. We can be flexible. We can work with your practice. It just is never going to work unless that will happen, and it will. Thanks for your time.
So much. Thanks for the gift for you as well. Thank you.